So this is a fun case. I want you guys to say the sign. Crazy paving, good. Diagnosis. This is a patient who is hypersensitive pneumonitis. Okay, could be. Anything else? Alveolar proteinosis. Good. That's a very good differential. So this patient, as you mentioned, as you clearly see, there is interlobular interstitial thickening. Along with that, there is a intralobular septal thickening. As evident, we call this as crow's feet. You can just see like a feet of a crow. You can see here, there is like a feet of a crow, and it is within the interlobular septa. When you see this, you call it as crazy paving. Do not call crazy paving when you have interlobular septal thickening superimposed just with ground glass. That's not crazy paving. Interlobular septal thickening, ground glass opacity, and intralobular lines. Then only you call it as crazy paving. This patient was subclinical, having a subclinical cough for the last 6 to 8 months. And then he came in and we saw a crazy paving pattern. And there is, in this patient, there is no history of hemoptysis. So diffuse alveolar hemorrhage is ruled out. There was no exposure to pets or any other allergens or any other inciting agents. So HSP is ruled out, and the patient having subclinical cough for a pretty long time. When we excluded all those things, what we ended up having is alveolar proteinosis is the diagnosis. So the patient underwent bronchoalveolar lavage, which turned out to be diagnostic as well as therapeutic. So this is crazy paving, excellent list of differential, but in exam setting, always think of alveolar proteinosis. When you say chronic ARDS, what will happen in ARDS is ARDS patients who are like very sick, they will be admitted in the hospital and they will be intubated for a long time. What happens when they undergo intubation is there will be consolidation in the lower lung and ground glass will in the upper lungs. What will happen is the aerated lung parenchyma in the anterior lungs will be exposed to oxygen radical damage from the ventilator, and they will end up having honeycombing in the anterior lung. And the consolidation in the posterior lung will prevent the lung parenchyma from getting affected by free radical damage. So when you see a patient who had a recent history of ARDS or a COVID pneumonia, admitted in hospital, came back, and then patient is having honeycombing limited to anterior lung parenchyma, that's chronic ARDS, or chronic fibrotic ARDS secondary to underlying whatever condition that incited it.